Hi, I'm Dr. Landon McLean. I am a naturopathic physician here at Creekside Health. I am originally from Ontario, a small town, a farm actually, 100-acre little farm, and moved out here about 7 years ago and never looked back. I've always been interested in medicine, always been interested and fascinated on how the human body worked. I just thought it was always so cool that, playing sport, you could throw a thing, you could kick a thing, you could move a thing and without even thinking you were doing it. So I'd always wanted to be in healthcare, I just didn't know within which facet. And over time, it just morphed towards natural medicine and prevention. It was my undergrad at Waterloo University that was geared towards health prevention, and I thought that was absolutely amazing in order to get the outcomes that people are looking for. Prevention is so much cheaper than treatment. So as I started to look more into different avenues for that, I found naturopathic medicine and never looked back. I certainly have an interest in gut health. I would say that is definitely the focus of my practice. Yes, it's the part of a lot of the root cause for a lot of health issues. So I've found that looking in that general direction, you can be quite efficient in order to find people's concerns, their issues, and help remedy the situation that brings them into my office. When someone first walks in to my office, it's typically an hour-long conversation. What you can expect during that hour is sitting down, having a conversation with myself. And I use that opportunity to get to know you better, to understand what it feels like to be you based on your condition. Because no two people experience an issue the exact same. So I think it's really important for me to understand what it feels like to be you. So that's where we start. We start with that. I have a ton of questions that I like to ask to get to know you, and from there we start to derive a plan. Now that plan can be rooted in a few different areas. It can be in the realm of diet, it could be lifestyle, it could be movement, it could be supplementation. In British Columbia I do have prescription rights, so if we need to, we could go in the realm of prescription medication, pharmaceuticals, and certainly diagnostics, lab testing, etc. I use a lot of lab work and diagnostics in order to create an efficient and appropriate treatment plan specifically for you. It varies. Because I live in a small town, we see lots of people for various reasons. If we were in a larger city center, I think I would probably see 2 to 4 things incredibly consistently. Because of the focus of my practice is digestive health, that is certainly the most common thing I see. Digestive issues, gas, bloating, digestive issues, bowel function, irregularities. I'd say those would be the most common things that do walk in my door. The other couple things that tend to be really common in my practice are issues with fatigue, stress management, those kinds of approaches. And more recently in the past year, I've really dove into regenerative injections for tissue damage, sport injury, and recovery. So I would say that's the third most common thing that comes in my office these days. Regenerative injections is kind of a generic term. It's a blanket term for approaches and strategies that basically help you and your body heal even faster than it normally would just on its own. So 2 really common examples of that I use in my office currently are prolotherapy and PRP, or platelet-rich plasma. They have a very similar sort of goal, which is, as I mentioned, to get your body to kickstart that healing and regenerative process. They differ slightly in their approaches and the ingredients that we use. However, they have the same end goal. It's a great question. I get that a lot. So PRP stands for platelet-rich plasma. So really what that is at the end of the day is we're looking for specific components of the blood. And the components that we're looking for in this PRP, or platelet-rich plasma injection, is we're looking for platelets and growth factors. So why do we want those? The reason we want those is because that will actually be the trigger, the catalyst, in order for us to have these regenerative reactions occur in the tissues of interest, of concern. So in order for us to do that, we actually take some of your blood and we spin it. And we do that in order to separate the different components of the blood. Once we've done that, we have all the components that we're looking for. We then take that component and we then inject that back into your body, into the tissue of concern. So whether it's your knee or your hip or your elbow or Achilles, it depends on the reason that you walk in the door. The most common uses that we use PRP or platelet-rich plasma are actually for cartilage damage. So specifically in the meniscus is a really common reason why we would use PRP. The other common location is your Achilles tendon, because that's one long, firm bit of tissue that doesn't respond very well to prolotherapy. So PRP is really good in the realm of cartilaginous tissue. That's where we use it most consistently. With the difference would be we tend to see regeneration kind of 2 to 3 times faster. It's hard to say for certain. We see variations in the individual, but on average we get you about 80% of that way pretty rapidly, I would say within 2 to 3 months. Yeah. What are the services that I provide? I provide nutritional counseling. I provide lifestyle approaches. I provide diagnostics. I provide intravenous therapy. I provide regenerative injections, trigger point release. Those are the most common things that I provide in office. That's the most common reason why people come in to see me. A naturopathic doctor is someone that tries their best to use natural approaches as best as possible, as often as possible, in order to help you achieve your health goals. Our philosophy is looking at the root cause of the issue rather than band-aid approaches. And our main sort of focus is to treat the whole person and not compartmentalize when possible. I love to teach, I love to educate, I love to talk with people, I love to learn their stories. I really enjoy empowering people to be their best selves. So when someone comes in and they have conversations with me and they have questions, I love to take any opportunity I can to help guide them and show them connections or connecting dots or giving them insight as to how things are intra-related, what these things mean. I like to talk with people, not at them. That's really important to me. So with that in mind, one fun thing that I usually tell a lot of my patients, especially my patients that are teachers of some sort, is, do you know where the word doctor comes from? And it's actually Latin from the word docere, and docere means teacher. So your doctor is your teacher. And sometimes I think we lose sight of that in healthcare. Your doctor is your teacher. We're not your dictator, we're your teacher. We're supposed to educate, we're supposed to help, we're supposed to empower. A true physician model should be a terrible business model in the sense that I shouldn't ever have to see you again. I should have to see you as little as humanly possible because of the outcomes, because of the education I'm giving you. You should be able to better yourself. So I have 2 answers for this. So I have a work one and I have a personal one. So in work, digestive health, hands down, is what I'm most interested in. It's my passion, it's my jam. Talking about poop all the time, I enjoy it. I know it might sound strange, but I can actually learn quite a bit about what's going on with you and your physiology based on your gut health. So that's a really important one for me in my work side of things. In work, one of the other things that I really enjoy and are passionate about is regenerative injections, which is prolotherapy, PRP or platelet-rich plasma, trigger point injections. And the reason that I've really started to create a passion here is it's something that I can see tangible results quite quickly. And in order to help patients to improve their outcomes, it is quite rewarding to see these outcomes with patients, especially in such an active place as Whistler. The amount of injuries are incredibly common. Pick a sport and someone's going to injure themselves doing so. So that's definitely a passion of mine that I've kind of developed in the last year. So something personally that I've become really passionate about in the past year or two, 2 years, is medicinal mushrooms. And growing up in Ontario, I'm sure there is a bit of a mushroom scene there, but I didn't know about it. I didn't look into it either, to be honest. But since moving here to BC, the Pacific Northwest in general has an amazing abundance of fungi or fungi, depending on who you're talking to. And it's been an absolute blast to learn more, to really dive in. I have just started trying to forage. Do not ask me how to do it properly or safely. I'm still learning, so I'm in the same boat. So the thing that I love about medicinal mushrooms is that you can literally just walk out your backyard and potentially find some. You can find mushrooms that are completely safe and edible and delicious. You can find mushrooms that are great for being immune boosters. You can find mushrooms that help boost energy. You can find mushrooms that you can put topically on cuts and scrapes. There's just a plethora of cool mushrooms kicking in your backyard. My medicinal mushrooms are a product that I've been working in concert with a company out of the Sunshine Coast. They've done most of the work. I've just been along for the ride. What we've got there is there are 5 different types of mushrooms that we have included into gummy form. We have chaga, we have cordyceps, we have reishi, we have turkey tail, and we have lion's mane. Those 5 are the 5 most common medicinal mushrooms that I use in my office in order to help better your life. This is lion's mane mushroom. The reason I use this in my office is for nerve growth factor. What that does is it improves cognitive function, it improves mental clarity, that brain fog that you struggle with, that word on that tip of your tongue that you can't quite recall, those words, those names, those faces, that what was so-and-so that we saw the other day. That's a perfect example of why I use these lion's mane mushroom gummies. The reason we chose to go with gummies as opposed to capsules or powder was that we actually find that you can get better extraction when you do a liquid-based extraction. We infuse that into the gummies, and that's our delivery vector, our delivery mechanism. With powders and capsules, it's just straight up mushroom, which is great, but we found that you can actually have a little bit more efficient dosages with using a liquid version, and then we put it into gummies because people just really like gummies. It is. So it's from, there's a water and an alcohol extraction process, and we use those to pour into the gelatin molds, and that is what the product ends up here. On average, I would say that people see me anywhere from 3 to 6 times, depending on the situation. It can vary quite dramatically depending on what's going on. Maybe 10% or so of the people that walk in my office are just looking to be proactive about their health. They're looking for strategies and approaches. How do I be my best? I feel pretty good overall, but how can I optimize? Is there testing that we could do to understand how to be better? Are there supplementations? Is there a way that I can tweak my diet? Is there physical activity that we can do? There's definitely an element of prevention and being proactive about your health that I can easily help facilitate. So your first visit is a 1-hour visit with myself where we establish kind of what we think is going on and establish a plan and a strategy and approach. So there'd be lab work that we would do. So depending on what's going on, we would have you come back once you have the lab work ready and available so that we can go over that in order to put together a more efficient and effective plan. On the subsequent visit, that is anywhere from 15 to 30 minutes, and during that time we go over any shifts and changes, roadblocks. That's the most common thing that I definitely want to know about. I want to know what's working and what's not working, because at the end of the day, it is up to you to make those shifts and changes. So if things are not working for you, that's fine. I work for you, so the important thing is to just be open and honest with me so that way we can get those outcomes going for you. I'll definitely send you resources. So whether that be links to websites, links to articles to read, if it's handouts that I provided, if there are books that I think you should consider. I try not to overwhelm you in the onset because we're just trying to build some foundation work, and creating new foundations or adjusting foundations can be time consuming and can be quite a lot of work for some individuals. So the importance is to meet you where you're at.